I attended a conference on medical marijuana in North Carolina some years ago now. But one of the things that tore at me was a mothers on a panel who talked about their children who were having chemotherapy. The children had cancer or had AIDS, and the mothers taking them in. And when the children came after the chemotherapy, would come from the hospital, and they'd take them home, and the child would be retching and couldn't eat and couldn't sleep, couldn't play, and they felt so sorry for their children. And what they would do, they talked about, they would leave the hospital. They'd take the child to the car, throw a blanket over the back seat, and blow marijuana smoke into the back seat, confined. And when they got home, the child felt well. The child wanted to play out with their children. The child wanted to eat. And it was such a difference. And the question they asked, the question they begged the conference was, why does my government make me do this? Why do I have to go to a back alley to buy something that's so helpful for my child? And those are questions we really need to ask ourselves as a society. These are, if this type of evidence is available, if this type of evidence can be demonstrated, why can't we make it available as a drug which can be used to help people? We use many other plant materials. We use many other drugs that are probably more dangerous than medical marijuana. But medical marijuana is one we cannot test, and if we cannot test it, we have a difficult time recommending it.